For the past few decades, healthcare has been a central campaign issue and has been a major concern to the average citizen of the United States of America. The concern was first addressed by President Lyndon B. Johnson, whose Great Society Reform program attempted to introduce social, economic, and political changes. LBJ utilized the program to propose legislation such as Medicare and Medicaid, changing the role government played in healthcare significantly, albeit for the disadvantaged. Medicare was instated in order to provide healthcare for the elderly, while Medicaid did the same for the poor. Both programs were introduced as amendments to the Social Security Act that Franklin Roosevelt instated in the years prior to the election of Truman.
President Truman was the first presidential candidate to make healthcare a plank issue in his election platform. Along with supporting other New Deal legislation such as labor and civil rights reform, Truman also promised his Fair Deal programs that include national health insurance. He emphasized the necessity of national health reform by stating that, quote, about 1,200 counties, 40% of the total in the country, with some 15 million people, have either no local hospital or none that meets even the minimum standards of National Professional Association. He was the first to consider the health of American children to be a public responsibility rather than a private one, and for this reason, fought for government funding of more hospitals across the country. He was quite successful in this regard and drew medical professionals to lower income areas by increasing federal funding. The controversial part of this bill, however, was not nearly as successful. The Social Security Expansion Bill, proposing a nationalized healthcare system, was labeled communist and socialist and was never given a chance to pass. Lyndon B. Johnson later declared that Medicare and Medicaid could not have been conceived without the work of President Truman.
In late 2007, the presidential election allowed for a great new debate over future healthcare reform. Media reported that nearly 72 million Americans did not have adequate healthcare coverage. Presidential nominee Barack Obama campaigned for a new universal healthcare program, promising for healthcare coverage for over 90% of the Americans. This promise was highly controversial due to the cost that would be associated with such a daunting program. President Obama was elected president and sworn into office on January of 2008. He was in no small part helped by the tremendous support he received from the Americans with an interest in healthcare reform. He held true to his promise to keep healthcare as a primary issue on his agenda, and he delivered a speech in June of 2009 that outlined his strategy for reform. Key issues to address were to mandate electronic record keeping, reduce nationwide obesity, refocus healthcare professionals' incentives for quantity of care to quality of care, reduce defensive medicine, cap out-of-pocket expenses, and create deficit neutrality. This speech drew intensive media attention due to its expansive view of the president's plans for reform, as well as his bold claims that the deficit would be decreased, not increased. To this day, the Congressional Budget Office wavers between these two options, sometimes declaring a deficit decrease of $1 trillion over the next 10 years to a deficit increase of the same.
On February 22, 2010, Obama released his first detailed plan for the healthcare reform. It was comprised of three targets. First, to provide for affordable and accountable healthcare. Second, to end wasteful spending. And third, to end fraud and abuse in the healthcare industry. This public announcement was followed by two official bills that were sent to the House and Senate. The first bill, entitled the Affordable Health Care for America Act, will place a 5.4% surtax on incomes over $500,000 for individuals and $1 million for families, but will allow for a public option, and insurance plans that cover abortions will not be eligible for federal subsidies, and a single national exchange will be created to house private insurance plans as well as a public option. Medicaid eligibility will also be expanded to 150% of the poverty level. These benefits seem to be outweighed, however, by the incredible cost of the bill, adding to an already historically high deficit driven up by the Iraq and Afghanistan wars. Another issue with the bill is that the compromises required to allow it to pass both the House and the Senate have crippled it, removing the single-payer basis of the plan and reducing its effectiveness. The bill takes effect on November 22, 2010. The second healthcare bill, known as the Patient Protection and Affordable Care Act, increases the Medicare payroll from 1.45% to 2.35% on incomes for individuals. There will be no public option, and each state will create its own insurance exchange under federal guidelines. This bill is anticipated to cost $871 billion over 10 years. It takes effect on December 26, 2011.
What does the future healthcare system of America look like? Although it is hard to predict what will come of healthcare, the compromises that characterize the discussion surrounding the bill, as well as the plans themselves, lead us to predict that Obama's healthcare bill will not be as effective as originally hoped. Currently, 15% of the United States GDP is comprised of the private healthcare sector. Once healthcare is nationalized, the money that flowed through the sector of the economy will be lost, reducing our nation's wealth while simultaneously amassing massive amounts of debt. Additionally, the nationalized healthcare system will most likely follow the trends of those healthcare systems that other nations have tried to instate. For example, Canada has had a nationalized healthcare system for some time. Every year that it has been in existence, it has run in deficit, draining the government's liquid capital while concurrently overtaxing the citizens. In Canada, elderly patients have reported waiting up to 2 years on a wait list for hip replacement surgery, while on average a wait time of 2 weeks is expected in the United States. This same extended wait time can be expected to arise in this country as well.
Additionally, being a doctor in America today is a profitable career. Patients pay through services through healthcare and out of pocket, and doctors charge what citizens are willing to pay. This is a natural regulation of prices via supply and demand. Many Americans strive to become a doctor. If the government begins to regulate healthcare and insurance, then they will have control of wages that doctors can charge for their services. Because the government will now be concerned with how much they will spend for each patient, it will only be assumed that doctors' wages will decrease, or not rise according to the trends that usually govern salaries. At the same time, many more citizens will be eligible for healthcare. With the new flood of citizens without the infrastructure to support them, longer wait times, shorter doctor's visits, and lower quality care can be expected in the future. The United States government has not successfully run a benefit program in history that has not amassed debt. Healthcare will not be the first, and it is not a stretch to predict a nearly irreversible increase in the American deficit.
Healthcare is, and will continue to be an important issue in American politics. Ever since President Truman's efforts in regards to healthcare reform, the American public has been concerned with the prospects of affordable health insurance, with a massive gain in interest with the 2007 to 2008 campaign and President Obama's offered plans. When the healthcare bill finally passed in Congress, it was met with just as much indifference and dislike as acceptance, giving a good indicator of its future in American politics. Its good intentions may have their expected effects, but there will be many negatives involved, such as an increased deficit and lower quality care. Hopefully, however, healthcare in the United States will become an affordable prospect in a country where nearly 2 out of every 3 personal bankruptcies is due to illness.